This is a new topic, care of surgical patient. So under this care of surgical patient, we have got preoperative care, intraoperative care and postoperative care. So this portion usually is asked, they sometimes ask regarding preoperative care. They can ask preoperative care of any type of surgeries, maybe preoperative care of abdominal surgeries or preoperative care of any respiratory surgeries and all. So the answer remains the same. So preoperative nursing care we will study in this preoperative care, then comes intraoperative care and then comes postoperative care. So questions can be anything, answer remains the same if they ask anything. Like postoperative care of any surgeries, if they ask also, you can write the same thing but you can apply it in that surgery as well and you can write the answers. And in intraoperative care, mostly the topic anesthesia is asked for 5 marks or sometimes for 2 marks also. This topic is very important. Now, before starting with care of surgical patient, we will just go through what is surgery first. Okay, so definition of surgery. So surgery is also a branch of medicine and most of the time it is a branch of medicine which deals with operative procedures. So these operative procedures are usually stressful for the patient because you are doing an incision and most of the time you are using instruments for the surgery. So that is a definition of surgery. Surgery is a branch of medicine that is concerned with operating. Usually it is a stressful procedure and it involves using incision or manipulating by the use of any instrument. So that is called as a surgery. So next is now moving on to types of surgeries or classification of surgery. So we have got different classifications of surgery. Like first of all, we have got according to urgency. It is divided into different types. Okay. Then we will study according to the purpose. Again, it is divided into different types. Then we will see the suffixes. Okay, so the suffixes are important because same suffixes will be coming for the different type of surgery. So first of all we will go on to urgency. So according to urgency we have got different classification. So first one is urgent surgery, next is emergent surgery, third one is required surgery and fourth one is elective surgery. So what is urgent or imperative surgery? Urgent or imperative surgery means here the surgery has to be performed within 24 to 48 hours because it is very urgent, but it can be performed within 24 to 48 hours. Okay, so that is called as an urgent surgery. Maybe there is an appendicitis or any other condition is there. In that case, you will have to do appendectomy or appendicectomy. So that also that can come as an example of urgent or imperative surgery. Okay, so here the surgery has to be performed within 24 to 48 hours. Next is emergent surgery. Emergent surgery means it requires immediate attention and if surgery is not done, it may be life threatening. For example, there was excess of bleeding is there, you have to stop the bleeding by performing surgery only, or already there is rupture or perforation is there, so you have to perform surgery. If you are not performing the surgery immediately, the patient may usually go into life threatening complication or patient may die. That is referred as emergent surgery. So urgent surgery means surgery has to be performed within 24 to 48 hours. Emergent means it is very life threatening, so surgery should be done immediately. Next is required or planned surgery. So required or planned type of surgery, here it depends on the preference of the patient. Maybe there is not emergency here, you can delay the surgery. Okay, so that is called as a required or planned surgery. So usually it can be planned according to the surgeon also, or according to the patient's convenience. Next is elective surgery. Here, the patient should have the surgery, but failure to have surgery will not cause any major issues. Okay, and this elective surgery means it is actually a type of planned surgery because it is not having particular time limit. You can schedule it anytime. Okay, so that can be called as an elective surgery. Okay, elective surgery, the patient should have the surgery but not very much emergency. It is usually planned or scheduled after some time. Next classification is according to the purpose. So according to the purpose, again we have got so many classifications. So first one is aesthetic surgery, diagnostic surgery, exploratory surgery, reconstructive surgery, ablative surgery, palliative surgery, transplant surgery, cosmetic surgery. Okay. So first we will move on to aesthetic surgery. Aesthetic surgery means it is usually done for improvement, like improving the beauty. For example, any type of plastic surgery if you perform, it could be on your nose or anything, lips and all, enhancement and all, that is referred as aesthetic surgery, where you are doing it for improving your beauty. Next is diagnostic surgery. Now, diagnostic surgery, as the name itself indicates, it is done to obtain a sample or for the diagnosis purpose. That is referred as diagnostic surgery. For example, biopsy. You are just removing a tissue or a sample to assess. Maybe most of the time biopsy is commonly done to assess if it is a tumor. Okay, what type of a cancer it is, whether it is benign or malignant, we come to know by that. So that is a diagnostic surgery. You are doing it to make a diagnosis. Okay, next is exploratory surgery. Exploratory surgery, it is usually done to get confirmation, okay, or for getting the measurement on extent of the condition. For example, laparotomy. Here, otomy means opening. Laparotomy means you are opening of the abdomen here. Okay, most of the time it is opening of the abdomen, that is referred as laparotomy. So usually here you will give a bigger incision. Laparoscopy, we have got one more term, that laparoscopy means you are doing a keyhole incision actually into the abdomen. Here you need actually a bigger incision, so that is called as laparotomy. We have got some surgeries like exploratory laparotomy. Okay, so that is an example of exploratory surgeries. Next one is reconstructive surgery. Now, reconstructive surgery is usually done to restore the function or appearance of any tissue. Suppose any tissue, there was any trauma or accident is there, and you want to restore the function of it. That time it is called as a reconstructive surgery. Most of the time reconstructive surgeries are done after the burns and all, like grafts and all we will perform. Next is ablative surgery. Now, ablative surgery means it is done to remove any diseased part. Suppose you have got a tumor, you want to remove the tumor. Now, that will come under a ablative surgery, whether it is a brain tumor, a lung cancer, or breast cancer, all that comes under ablative surgery. Next one is palliative surgery. Now, palliative surgery means it is usually done to relieve the signs and symptoms. For example, relieving the pain. Now, patient will be usually given this palliative type of surgeries in order to only relieve the symptoms. Here, palliative surgery will not cure the disease. You should remember that. It is only relieving the symptoms. Commonly, maybe it reduces the pain or discomfort in the patient. Next one is transplant surgery. Now, transplant surgery means it replaces the malfunctioned structure or the organ. For example, there is one organ is already deceased. It could be your maybe most of the time your pancreas, it could be, or your corneal transplant. All that comes under example of transplant surgeries. So you can transplant the malfunctioned organ. The malfunctioned organ is usually removed and then the donor tissue will be replaced back. Next one is cosmetic surgery. Cosmetic surgeries are usually done to improve the personal appearance. Most of the time we will use laser surgeries and all to improve the appearance. So that will be an example of cosmetic surgery. Next classification is according to the degree of risk. So according to the degree of risk, we have got two types of surgeries. One is minor surgery and one more is major surgery. Now minor surgery means it involves very little risk. Okay, there it can result in certain complications, but most of the time it is having very less risk. Example, your tonsillectomy. Tonsillectomy means actually a removal of the tonsils. Biopsy means it is removing a tissue or a specimen sample for diagnosis purpose. Next is major surgery. Now, major surgeries are actually very complicated surgeries where there will be a very high risk. Okay, it could be your neurological conditions or when you're performing surgeries, especially of the bones and all, that could come under a major surgery. Now, heart surgeries also come under major surgery. We never know what will happen to the patient yet. Okay, so that is about the classification of surgeries. Next is now moving on to certain suffixes. Now, these suffixes continuously will be there in all the surgeries, types of surgeries. So you should know these suffixes. For example, scopy. Scopy means actually looking into. Okay. Scopy means actually looking into. We have got different type of scopies actually, like retinoscopy. So retinoscopy means you are observing the retina. Okay, you are looking into the retina, that is referred as retinoscopy. Similarly, we have got bronchoscopy. Bronchoscopy means you're looking into the bronchus. Okay. Then similarly we have got colonoscopy. So colonoscopy means you're looking into the colon. So these are the examples of scopies. Next is moving on to ectomy. Okay, ectomy. Now ectomy means actually it is removal. Ectomy means removal. Most of the time you will be having this appendicectomies. Okay, so appendicectomy means it is referred as removal of the appendix. Okay, so other than that you have got your tonsillectomy, that is also an example of ectomy. Okay, other than that also we have got thyroidectomy. Thyroidectomy means it is the removal of thyroid. Then we have also got hemorrhoidectomy. Hemorrhoids means actually it is removal of the hemorrhoids. So these are some examples of ectomy surgeries. Next is moving on to lysis. Lysis means actually it refers to destruction. Lysis means it refers to destruction of. Next one we have got orraphy. Orraphy means actually it is repair or suture. Orraphy refers to repair or suture. Next one is ostomy. Now, ostomy, it refers to creating opening. We have got colostomy, jejunostomy, such things. Okay, ostomy means creating opening. Next is otomy. Otomy means you are cutting into or making incision. Okay, otomy means you are cutting into or making incision. So that is referred as otomy. We have got like amniotomy, where you are making incision into the amniotic fluid there. Okay, next one is plasty. Plasty means repair or construction. For example, we have got hernioplasty and all. Okay, so plasty means repair. So remember this terminologies, accordingly we have got this meanings of this terminologies.